experts say that even after receiving a vaccine, people can still spread COVID-19 and even develop it. If we still can be infected and spread COVID-19 even after being vaccinated, why do we need the vaccine? Isn't that a wasteful thing and does not bring any benefit to us? I'm sure all of you have had the following questions. Don't worry and don't panic because today on Spoke, we're going to be talking about the COVID-19 vaccine. Now, of course, vaccines were created by experts, and there is definitely a reason behind the creation of this vaccine. How does COVID-19 vaccine or the mRNA vaccine work? The mRNA vaccines are a new type of vaccine to protect against infectious diseases, especially in the COVID-19 vaccine development. The mRNA vaccines instruct our cells to produce a harmless piece of protein known as the spike protein. This spike protein can be located on the surface of the COVID-19 virus. The COVID-19 mRNA vaccine is then applied via the upper arm muscle. The cells use the instructions from the mRNA to create the protein piece until they are within the immune cells. After the protein is made, the cell decodes the instructions and discards them. The cells then display the protein piece on its surface. Our immune system know that the protein isn't supposed to be there, so they start developing an immune response and producing antibodies. Much as a normal infection with COVID-19, our bodies have learned how to shield themselves from infection at the end of the process. Like all vaccinations, the advantage of mRNA vaccines is that those who are vaccinated receive this immunity without ever having to risk the severe consequences of contracting COVID-19. These vaccines can help to prevent serious illnesses from COVID-19, but they don't protect you from contracting the virus. In the meantime, people who are vaccinated are advised to continue and adapt with the new norm, which requires, of course, wearing a mask, washing hands, sanitizing, and maintaining proper physical distancing, 1 meter or more. The reason is because vaccinated people can still be infected by the novel coronavirus. Now, according to a report published in the New England Journal of Medicine, protection from the Pfizer vaccine takes about 12 days to kick in, and then it's predicted to be about 52% effective weeks later. So the good practice here is that we should all continue to act as if we've never gotten the vaccine. The vaccine also prevents the COVID-19 virus from spreading and replicating, which allows it to mutate and possibly become more resistant to vaccines. Also, of course, a COVID-19 vaccine can cause mild side effects, but don't worry, it can all be under control. A COVID-19 vaccine can cause mild side effects after the first or the second dose, and these effects include pain, redness or swelling where the shot was given, fever, fatigue, headache, muscle pains, chills, joint pain, nausea, vomiting, feeling unwell, and swollen lymph nodes. Once we receive the vaccine, maybe we will be monitored for about 15 minutes to see how our body reacts. Most side effects occur within the first 3 days after the vaccination and usually last only 1 to 2 days. To date, the doses of COVID-19 vaccine given worldwide are more than 269 million, with 56 million fully vaccinated and 0.72% population in the world fully vaccinated. There are 66 vaccine candidates in clinical trials as of February 2021, with 17 in phase 1 trials, 23 in phase 1 to 2 trials, 6 in phase 2 trials, and 20 in phase 3 trials. 4 other candidates' trials were halted. Several COVID-19 vaccines have shown efficacy of up to 95% in preventing symptomatic COVID infections in the phase 3 trials. There are approximately 11 vaccines approved by at least one national regulatory body for general use, namely 2 RNA vaccines, the Pfizer-BioNTech vaccine and the Moderna vaccine. For conventional inactivated vaccines, VVIP, Corvi, Covaxin, CoronaVac, and Covivac. 4 vaccine factors, Sputnik V, Oxford vaccine, AstraZeneca, Convidacia, and Johnson & Johnson vaccines, and 1 peptide vaccine, the ApiVac Corona. Among the most popular and wanted vaccines in the world are the Pfizer-BioNTech COVID-19 vaccine, which is 95% effective in preventing the COVID-19 virus with symptoms. This vaccine is for people aged 16 and older and requires 2 injections given 21 days apart. The second dose can be given up to 6 weeks after the first dose if needed. Another vaccine is a Moderna COVID-19 vaccine, which is 94% effective in preventing the COVID-19 virus with symptoms. This vaccine is for people aged 18 and older and requires 2 injections given 28 days apart. The second dose can be given up to 6 weeks after the first dose if needed, much like the Pfizer vaccine. Johnson & Johnson COVID-19 vaccine is proven 66% effective in clinical trials in preventing the COVID-19 virus with symptoms as of 14 days after vaccination. The vaccine was also 85% at preventing severe diseases effectively with the COVID-19 virus and at least 28 days after vaccination. This vaccine is for people aged 18 and older and only requires 1 injection. Some of us might worry about the safety of the vaccine and preventing them from getting the vaccine. Now, it is true that COVID-19 vaccines have been developed in arguably a very short time. But no worries, COVID-19 was going through many times of trial tests and clinical tests just to make sure that the vaccines don't affect our bodies. We are not forcing you to believe and getting vaccine injections, but please remember that this vaccine is built to save human lives. Vaccines were not invented for the first time but have been used around the world for quite some time. For example, vaccines that have proven effective include the influenza vaccine, the HPV vaccine, and the chickenpox vaccine. For those who believe in conspiracy theories, Illuminati, and the agenda of the Antichrist, the decision not to receive the vaccine is your own choice, but do not incite others to get it as well. You may not believe in vaccines, but do not influence other people, as well as any religion in the world certainly prioritizes the safety and lives of its adherents. So reflect on this and do not be too fanatical or obsessed with theories that have not been confirmed.